COVID is having a little bit trouble totally dominating?
COVID not totally dominating? That sounds pretty nice after a year and a half of this pandemic, but doctors say we might want to hold off on celebrating. And that is because doctors say there are other viruses that are just spreading. And while COVID isn't the only germ in town, it is still a serious problem, and it has a whole lot of company.
So it's not dominating quite like it used to, so there's more other viruses circulating about.
Now, one of those viruses is RSV. It's an illness that mainly affects babies and small children. Sometimes it's like the common cold, but in other cases, the child can have a hard time breathing and can get really sick. In August, for example, one Greensboro woman had 2 kids sick with RSV at the same time, both of them younger than the age of 3. She says she had to get up throughout the night so many times to make sure that her children were okay.
We just basically at night made sure that we were listening to their breathing. With the 5-month-old, we had to wake up and give her saline and also use the nose sucker on her nose several times a night.
Well, doctors say they started seeing cases in early summer, and the numbers have been going up ever since. From now until 6, we're going to be talking to a doctor from Cone Health to learn more about this virus and how you can protect your children. So we're going to dig into it. We're joined by Dr. Michael Cinoman. He is the medical director of the Pediatric Intensive Care Unit at Cone Health. So first and foremost, just a quick explanation. What is RSV?
It is a respiratory virus. It stands for respiratory syncytial virus. It has been with us for a long time. As long as I've been practicing, we've known about RSV. It does cause what we call bronchiolitis, which is an viral infection of the airways, and it typically affects small children. Usually the smaller they are, the more severe, and it causes wheezing, much like an asthma-like illness, except for little babies. But it can affect older people, and in fact, in elderly, it can become a very severe virus too, much like the flu, but it's very, very common respiratory virus.
All right, so what are some of the symptoms of RSV and how serious does that infection sometimes become?
Well, it's extraordinarily common. Most babies will actually get RSV in the first year of life, literally close to 100%. It's very hard to prevent, and it's very common and very contagious. However, for most children, it is a rather benign cold. The symptoms are almost exactly what you'd expect. Coughing, congestion. Sometimes babies get fussy. They don't eat as well. They're irritable. It can be associated with a fever. Not so much GI illness, but babies will spit up when they're coughing a lot. And on some cases, as I said, difficulty breathing. They'll develop what you would think of it as an asthma attack.
Just quickly,
wheezing and difficulty breathing.
Is there a vaccine that is available?
No, they've been working on a vaccine for RSV for many, many years. And for whatever reason, unlike COVID and influenza and a lot of other things we have vaccines for, it has been very challenging. So no, there is not an effective vaccine for RSV.
Okay, and any way we can keep it from happening to our kids? You basically said 100% of the kids usually get it.
It's really tough. You would have to, it was very interesting this year because so many people were isolated. RSV is normally a wintertime virus. We see it in the months of October through January, and this time we're seeing it in the summer because so many people were masked.
I see. Okay. So the note to those parents at home is make sure that you're talking to your doctor and you know when you need to go in and see your doctor. Dr. Thank you, Cinoman. Dr. Cinoman, thank you so much for joining us. We want to make sure you have this information. It's in our Who Wants to Know section of our website.